The history of the nursing uniform, the transformation of uniforms over time. 1850 to 1900, Crimean War era, presented by Wendy Corrales.
Hi, my name is Wendy Corrales, and today I'll be discussing the very first nurses' uniforms. During the late 1800s, Florence Nightingale was working very hard to turn nursing into a respected profession. During her time, there would have been no nursing uniform to distinguish nurses to their patients as well as other staff and the public, and it is said that they were sometimes confused for servants. The first time we begin to see a uniformity of dress develop is when Florence Nightingale opened her school for nursing in the 1860s. There was no uniform for the school or students per se, but Florence Nightingale's students did begin to mimic her style of dress, often wearing long dresses in dark neutral tones such as black or navy. The dresses were embellished with lace, and the girls often wore bonnets. Eventually, however, one of Florence Nightingale's students did produce the very first nursing uniform, and it would have looked a lot like the one that the mannequin is wearing next to me. Some of the features of this uniform are very long skirts, very heavy fabrics, starched cuffs and long sleeves, as well as high collars. It's thought that the nurses' uniforms were designed to look like nuns' habits, as nuns were the first carers for the sick before they were nurses. But it's more likely that the uniforms were just designed to mimic the styles of the time, where long skirts and heavy fabrics and starched cuffs were the norm. Even though that was the fashion of the time, it wouldn't have been very comfortable or functional for nurses to wear this, as it wouldn't be easy to get around, and somewhere like Queensland it would be very hot and uncomfortable.
Early 1900s, presented by Kelly Harris.
Hi, my name is Kelly Harris, and I'll be discussing the nursing uniform introduced during the World War I era. This was between the years of 1914 and 1918. This mannequin to the left of me is an example of the uniform worn. This uniform was designed for protection against illness and was considered an expression of feminine virtue. During this time, it became clear that the previous uniform was no longer practical. As the war brought in many wounded soldiers, the nurses needed to be fast and efficient. Bulky aprons showed in the previous uniform started to disappear. Skirts were shortened for better mobility, as you can see on the mannequin here, and tippets were introduced, which is this overcoat, this blue overcoat, as you can see here. Badges were sewn on to the tippet to show superiority and to denote rank. This uniform began to change after World War II, which will be shown in the next presentation.
1950s to 1990s, presented by Kelly Seeney.
Hi, my name is Kelly Seeney, and today I'll be discussing the nursing uniforms that were introduced post-World War II between the 1950s and the 1990s. As the nursing profession grew more popular, there was a high demand for uniforms to become mass-produced and easier to clean. The changes in the standard uniform, as shown on this mannequin, was the hems became shorter and the waistlines began to get tighter, and there was also the open collar introduced. These were not only for comfort and practicability, but it was also to keep up with the fashion of that time. In the 1970s, as more male nurses came into the profession, pants were then introduced into the standard uniform, and then in the 1980s, the cotton hats that they used to wear became disposable, and by the end of the 80s, hats were almost gone altogether. In the 1990s, scrubs were then introduced in most hospitals across the countries. Scrubs are designed as a shirt or a tunic-style top worn with trousers. These are meant for much more practicability, as you can move a lot easier in pants than you could in a dress that was worn in the 1960s. These have become much more popular, and they are available in a lot of colours and different prints. We've seen a lot of changes over this era that have helped develop the current uniform we see today.
Current Queensland Health nursing uniform, presented by Madeline Cregan.
Hi, my name is Madeline Cregan, and today I'll be discussing the current Queensland Health registered nurse uniform. The Queensland Health Uniform Policy states that nurses must dress in accordance with workplace health and safety standards, infection control standards, and also in accordance with their professional position. The standard uniform has been developed so that nurses are able to be easily identified by the public, to promote a professional public image, and also to provide authoritative access in the performance of their nursing duties. So, The current female uniform consists of the shirt that I'm wearing, which also comes in a looser fitting style, and this can be worn with long navy or charcoal pants or a 3/4 length skirt. There's also a t-shirt dress and a pinafore style dress that's available for women as well. Now it's recommended that for females, if they decide to wear the skirt or the dress, that they also wear stockings with this as well. So for males, the uniform consists of a shirt of the same design as this, and also they can wear the navy or charcoal pants. In addition to the uniform, nurses are also required to wear black or navy closed-in shoes that are non-permeable to fluids and sharps. As you can see, in comparison to the previous demonstrations, the current uniform has been adapted over time to be more comfortable and user-friendly with the different varieties of styles that are available. It's our responsibility as nurses to ensure that the correct uniform is worn, to maintain safety and professionalism, and also to gain the trust and respect of our clients.
The nursing uniform has evolved over time to increase comfort and functionality for nurses in practice.